You're welcome back to the Arise interview, where we speak to the newsmakers as well as ordinary people doing extraordinary things around the world and featuring the voices at the heart of the stories. I am Christian Nogodo. Thanks for staying with us. There's no shortcut to a healthier society. Those are the exact words of the World Health Organization, urging leaders in both public and private sectors to work together to clean up our air and mitigate the health impacts of climate change. The World Health Organization notes that the climate crisis is a health crisis, saying air pollution kills an estimated 7 million people yearly. It is said that the same emissions that cause global warming are responsible for more than 1/4 of deaths from heart attacks, stroke, lung cancer, and chronic respiratory disease. We'll continue our discussions in a moment, but here is an educative video about the link between climate change, extreme weather, and health.
We know climate-related changes on our planet cause extreme weather, and extreme weather has life-changing effects. We see this in the rise of weather-related disasters around the globe. But there's one aspect of this topic we don't hear much about. How does climate change affect our health? Well, as temperatures rise, record-setting heat waves become more frequent. They can lead to heat-related illnesses and dangerous cardiovascular issues. Rising sea levels and unpredictable weather mean more superstorms and flooding, wildfires and droughts, injuries, property damage, even homelessness and loss of loved ones. Superstorms also expand habitats where insects thrive and multiply. Mosquitoes and other bugs can spread diseases like malaria and West Nile virus. As the Earth's carbon dioxide levels increase, air quality declines, causing respiratory issues like asthma and lung cancer. Bouts of salmonella rise. Bacteria in water contaminates seafood and shellfish. And we see a surge in gastrointestinal illnesses and bloodstream infections. With all of this, we're looking at serious grief and emotional trauma. But there's hope. The good news is we can make a difference, but we must act now. What can you do? Take action. Unplug devices and chargers when not in use to reduce your energy consumption. Walk, bike, or use other means of active transportation. Get your food locally, buy only the food you require, and give edible leftovers to those in need. At the city, state, and national levels, stay informed. Let your elected representatives know what you think.
Well, that's a very instructive educational video there on health challenges arising from climatology. I still have in the studios with me Zainab Zarif, who, like I said, is the director in charge of the Traditional, Complementary and Alternative Medicine in the Department of Federal Ministry of Health. She is a pharmacist and fellow of the Pharmaceutical Society of Nigeria, and author of several books on traditional, complementary and alternate medicine. And I have as well Dr. Ezeokeke Chika Odinaka, who is a senior medical officer with the Wuse General Hospital. Yeah, let me come to you before we talk on the issues of climatology. The relationship between the traditional and alternate medicine and the orthodox medicine. How's it been? The NMA and its people, or the NMA and the Dental Health Council always shoulder high. And we've all agreed here that traditional medicine from abroad, China, India, even America, is making inroads. Is it not time for you to drop your egos now?
It's more than dropping egos. It's actually about doing the right thing. You know, we agree that a lot of the traditional medicine has been very, very effective in the treatment of many illnesses, like sickle cell disease.
Oh, the orthodox doctors, yes, you've agreed in that?
Yeah, we use it. I've used the artemisinin. Yeah, so why we agree, I've always been in agreement.
Yes.
Why we agree with that, the problem we have in Nigeria is because most of this traditional medicine, are not produced in a standardized way. Apart from that, if you claim a drug treats a particular illness, you have to undergo clinical trials, which takes a lot of funds and a lot of time. You know, those clinical trials are far-fetched in Nigeria. I can't even remember any done in Nigeria. I don't know about any. I've not read about any. You know, most of what we use.
There was a man who claimed to be curing HIV/AIDS then at the start of this demo from 1990.
Still there.
Oh, he's still there, yeah.
Abalaka.
Yeah.
Abalaka,
And he's still curing.
I
saw him.
He's
You
still
saw a
curing.
video.
Yeah, I saw the video. He's
going
still
around.
curing.
He's
Is he?
looking for research.
But they actually called
They
him
thought
out.
he
Do
was
the
dead.
research.
They
Do
said
the
that
research.
what?
And
Research.
he did not make it standardized. If everybody's looking for, you know, the easiest way to do these things, if you tell me,
just right.
if you tell me to eat this thing and I'll get well, I'll be willing to
for
try
a
it.
sick person.
Yeah, I'll be willing to
not
try it.
for
But
somebody that is healthy.
you understand? I'll be willing to try it, but you have to prove to me how this particular molecule of this drug interacts with my system.
Okay. Just to add to what she's saying,
You know,
because that
get a
is my
pathophysiology.
Yeah, that is my mandate, having the head of the department. I want to tell you that in this, just last month, we had a meeting between traditional medicine practitioners and the conventional doctors, sitting side by side in Lagos. Unbelievable.
Yeah.
That program was organized by WAHO, World African Health Organization, West African Health Organization. We're having 15 member states. We were dialoguing. This is what you need to do. This is what we need to do. Look, the practitioners need to learn, and the doctors too need to learn. The knowledge is sharing.
Yeah.
Because they have what you don't have.
Yeah.
You could do the practice. They have the products. And we need these products
together.
to do. So we respect them. What they want, the real traditional medicine practitioners, they have the formula, they have the knowledge. We can't go into the lab blindly. Something the Chinese call them the barefoot doctors. They said we do not ignore our barefoot doctors because they are the basis of our information. So we need them, but at the departmental level, we are trying to collaborate with them, database, and train them. They should know where they should stop. And this primary healthcare level we are talking about, in the communities, they only know the traditional medicine practitioners. WHO itself has said about 70% of the world access basic health care from these practitioners. I do tell my colleagues, we do argue. I say, do you want us to kill the traditional medicine practitioners because maybe you don't believe in them? What we need to do, if my father was a healer and you tell me that I shouldn't listen to him, he trained me to be a pharmacist, for example. So I should be able to know his knowledge, get the knowledge. That is why I'm educated. How do we improve on the knowledge? So we are calling on them. They need to understand that they cannot die with the knowledge. If they die with the knowledge, they have cheated humanity.
And how is the Nigerian government, you know, going to extend the efficacy and importance of, you know, these traditional medicine practitioners?
Good. NAFDAC is there, regulatory agency. It has its mandate.
You're not thinking of legislating it?
Like I just told you earlier on, that we have a traditional council bill awaiting passage at the National Assembly. Once this bill is passed, like she said, her fears, there will be regulation. Just like we have in other health sector, dental and medical council, pharmacist council, nursing. So the fake traditional medicine will naturally go away because there will be penalties for wrongdoing. And for us, the good thing about Africa is that we'll be able to know more drugs for our people. We'll be able to know more molecules, like you have said, for the benefit of our people. If we don't do that, we can never achieve health care. If you cannot discover what you will use for your people, you rely 100% on importation. It's a vicious cycle.
Zainab, it's quite expedient, you know, what you're doing with the government, revolutionizing the entire healthcare system, bringing the traditional medicine practitioners into the mainstream
and that is the mandate.
Medicine.
Yes.
Fantastic. But you see, one discouraging thing, if you look in the last decade, the budgetary provisions for healthcare in Nigeria does not meet the 1% of the national budget required by WHO in a country of 200 million people. There is stagnation when you look at it. In 10 years, all that's been budgeted is 3,296,405,000,000 naira. It's just a drop that would, evaporate in the ocean that you can't see. How does this going to help to bring together these various practitioners? How is it going to help in research development?
Multidimensional approaches. Yes, we have observed the budget. It has not really have significant impact, but at least there is some step. You look at it like we said earlier on. We said that every government must take its own responsibility. This is the federal government budget. Where is the state budget for health? The state should be able to increase more budgetary allocation for health, and they should focus more. And then the WHO we are talking about and other development partners, they are giving supportive. My own,
they must be wary
yes,
by now.
They should be giving. There's fatigue.
Yeah, donor fatigue. You know,
but the same donors should listen to us where we want our priorities. Don't tell me, for example, you want to give me 78 million to buy mosquito nets.
You don't need it.
We don't need it. Give me that 78 million for research to develop more molecules and drugs for our people. So while they are getting fatigue, they should sit down with us and look at the possibilities.
And your collaboration
and
with
our
NIPRI,
collaboration
for
with
example.
supporting NIPRI.
Yeah, how strong is it?
There is strong, because I know that
a lot of Nigerians.
But it could be better.
Yeah, a lot of Nigerians barely hear from them NIPRI than the rest.
You know this mentality. This mentality of
civil service.
You are here, but you are surprised.
You are breaking it.
Yeah,
you didn't need a ministerial approval to come on this program.
Why did I come? Because I knew it's an advocacy and awareness in recognizing the importance of traditional and complementary medicine.
Absolutely.
Often at times you wonder, why is a pharmacist talking about traditional medicine? That is why we have pharmacognose, which we study. And for me, per se, I inherited traditional medicine, herbal medicine specific, because I want to look at the component. There are many components in traditional medicine. You have the traditional birth attendants that are doing delivery. We have the herb sellers. We have the herb producers. And those that are knowledgeable in herbal medicine, we would want that, because scientifically we will see the product and we expose the product to research and be able to get dosage. Yes, I was trying to draw her attention. I always tell people there's a value chain for discovery of drugs.
All right, value chain for the discovery of drugs. We're going to interrogate that after we take some messages. You're still watching the Arise interview. We've got more. Stay with us. You're welcome back to the Arise interview, and we're still interrogating not just medical development, but all corpus of medicine in Nigeria and Africa, and the alarm that the World Health Organization is released, which it says is urgent health challenges for the next decade, and urging world leaders to invest more resources in core health priorities and systems. But ladies, let's look at climatology and the effects and the extreme weather on health. The climate is really changing, everybody can say. Just about 3 weeks ago, the weather in this part of the country was so, in fact, all over Nigeria, it was chilly, as if, we're in Europe and the rest. In Jos, it was 7 degrees. The same thing in Kano. In Abuja, it was about between 10 and 14 degrees and really cold. What kind of, preparedness, awareness do we have in this changing condition in the midst of all the diseases that is still plaguing us, that are preventable, as you said there, Dr. Ezeokeke?
Yeah, the Harmattan period, as you say, it's a very critical period, especially among our the individuals of our country. Because this is a time when we have a lot of respiratory diseases.
Diseases, absolutely.
Respiratory infection. I've seen a lot within this period among the children, the adults, a lot of asthmatic attacks. We see a lot. Then you see prevalence of TB infection, because
Coughing
you know
and the rest.
there's
These are
most
airborne
of those
diseases.
who have these airborne diseases, you know, can easily transmit it, you know, because the dust itself makes you sneeze and release droplets of infection, and also you have a lot of respiratory illnesses. Those with asthma come down with frequent attacks, and they have a lot of respiratory. Apart from that, we have other issues. You know, there are a lot of mosquitoes right now. You know, so children can come down with a lot of malaria.
Oh, it's a period for mosquitoes to fester.
Breed, yes, to fester.
So it's not an issue of open drains
yes,
now.
it's not an issue of open drains. So we have a lot of mosquitoes right now, you know, and so many health challenges, basically. The cold weather itself can make somebody have an allergic reaction. So you have talked about the asthma. COPD, those who smoke might feel the need to smoke more, and that will expose them to chronic obstructive airway disease and all. So that's the respiratory challenges we'll be having during this period a lot, you know, and a lot of prevention has to be done. Like, for example, if the weather is too dusty, you can close up your windows for a while. The weather is cold, so you won't feel the heat smell. You know, that's what I do in my house, because I know my children have a lot of hyperactive airway disease. So if we expose them to a lot of dust, they tend to have asthmatic attacks. So we have a lot of these things, you know. Prevention is the goal, you know. I've had asthmatics that have stuck to prevention and they've not had attack in 10 years. I myself, I'm an example of that. The last time I had an asthmatic attack was more than 15 years ago, you know. If you know how to prevent most of these illnesses, they are very much preventable. And there will be no, and prevention reduces more burden on your pocket and every one of it. So in the long run, to even help with the effect on climate change, a lot of preventive measures have to be put in place. You know, teach people how to do these things. Respiratory, the respiratory infections too. If the child has a good immune system, the child feeds well, you know, the immune system is proper, they won't.
Particularly when the child must have taken all the childhood disease vaccinations.
Yes, and then one more thing too. We had there was a time the IDPs. There were a lot of IDPs too. We had a lot of TB, you know, because malnutrition, severe malnutrition is a risk factor for TB. You know, so when we have a lot of
manifest really quickly.
Yes, quickly and easily, because when the child or the adult is malnourished, you know, it suppresses the immune system, and you know, makes all those opportunistic infections to come on. Yeah, so then there's the illness.
Okay,
and just to add to her climate change issue, you know, apart from the peculiarity of this weather, being chilly, being dusty, it's a whole holistic approach towards climate change. Carbon dioxide emission is increasing. There is tendency for desertification, but all is not lost, because some measures should be put in place. I'm sure you've heard about the green wall, trying to grow more trees, and then we are raising awareness, the need for people to stop cutting down trees. We are looking at the national park that is
talked
involved
about growing about 20 million trees. I don't know if it's been launched and if we are growing it already.
Conservation, where there are conservators that are now working to ensure that you cultivate. For us in the department, we are telling you, you can cultivate or grow economic trees, because apart from serving for preventing climate, and they also have economic benefit and nutritional benefits. That is why you see plants that we call drought-resistant plants, like moringa, are being cultivated everywhere. And then a quick one is that we always call what we call simple remedies. You know, you cannot always go too orthodox. Swallowing those pills are poisonous. Every drug is poisonous. Like I've heard the in thing is that people are using paracetamol to boil pomo. That is unbelievable. That is why there's increase in toxicity and in kidney diseases, because taking paracetamol alone, I cannot believe
who could have taught those Nigerians that
innovation. Even we, the pharmacists, I never thought that there could be something outside pharmaceutical realm to be used for otherwise. So who knows, that could be the facilitating factor for all these diseases. So we are talking about remedies. I promote what I call the kitchen remedies. Those herbs and spices that are in the kitchen, this is their time. They are medicinal. The lemon, the ginger, the garlic, the cloves, the trinity plants, which we call the garlic, the onions, and the ginger. A good tea, keep you warm. Put some ginger and put some cloves and some honey and lemon. Give it to the kids, keep them warm, rub some what I call aromatherapy. Aromatherapy is the use of essential oils to keep you warm. You know the granny remedy, where you use all those mango leaves, the pawpaw leaves to do that process. You know your mother was teaching you, but you didn't understand what she was saying. Science has now told us that that process is called diaphoterism. That is the process. You warm up, you tone the liver, you tone the kidney, you strengthen, because the body has the capacity to heal itself.
Yeah, I thought that was usually when the children have
Yes.
malaria and they are
Beyond
covered
that,
and the rest,
that
for the
is
air pulses
for
to be
quick
opened and the rest.
perspiration, because we are talking of detoxification. And one of the organs of detoxification, this is where orthodox medicine does not capture. Natural medicine has its own. So we are now talking about integrative medicine.
So one can
A
be
bit of this,
detoxifying
a
like
bit
that
of
with
that.
that hot water, mango, pawpaw and the rest once a
Cleanse your
month or
system.
something.
Excellent. Is a process, because the aroma from those leaves, from mango leaves, lemongrass, they bring out what we call the essential oils. And these oils have healing properties, and they are able to tone the organs, and the body
fresh again.
will now wake up and has the ability to heal itself. No matter what we do to the body, we must. That's why we are talking about strengthening the immune system.
Yeah.
If you strengthen the immune
Anything that
system
strengthens the
through
immune
good nutrition,
Yeah.
let us talk about good nutrition.
Yeah.
Traditional foods are the best foods.
Yes, I agree.
Go back to those your mother's foods.
Vegetables.
Vegetable
fruits.
foods, the simple foods that we eat, the
And they
whole
are
meal,
cheap.
Yeah, very
the
cheap.
sorghum. Do you know the millet? We do the pap. I'm sure you want to go and eat oats. The locally made millet with some husk in it is a good way to go. We have the soya beans. We have what we call the tofu, the curdle. This boosts the immune system. A lot of oranges, wasting away,
Yeah.
rich in
Oranges
vitamin
are
C.
good, vitamin C.
These fruits are there. Vegetables are there, which we must grow, even to prevent climate change.
Yes.
So very quickly before we go, we'll have just a minute. What kind of policy direction would you want the federal government to be doing so that the likes of WHO and other donors can really come and meet your needs? Very quickly.
I want the federal government to focus on primary health care and strengthen our primary health care
But
system.
we just agreed that primary health
States.
care is for the states and the local government. Why are
Yes.
you are overburdening the federal government again?
Again.
No, I'm not.
She's
overburdening
talking about the states.
I'm talking.
Yes.
I'm talking about as everybody has to put hands together
Together.
to make it work. You
Okay.
know, if the states are not ready, the truth is, at the end of the day, if the states are not ready to do the right thing,
Yeah.
it still reflects on the federal government.
Okay, Zainab, you want to say something very quickly?
Prevention is always better and cheaper than cure.
than cure.
Stay healthy, good nutrition.
Yeah.
I think
you.
I've had the best time with these ladies, two eggheads, one a pharmacist, one a medical doctor. Zainab Sharif, pharmacist director, traditional complementary and alternate medicine department, Federal Ministry of Health, and she's also a fellow of the Pharmaceutical Society of Nigeria. Dr. Ezeokeke China Odinaka, a senior medical officer with the Department of Internal Medicine, Wuse District in Nigeria's capital. Thanks so very much indeed for coming.
Thank you.
Thank you.
sir.
Well, that's it for this edition of the Arise interview. Do remember to join us again tomorrow. From me and the entire team here in Abuja, goodbye and thanks for watching.